External ear infections happen in the ear canal. That's this portion of the ear. Here is the eardrum. External ear infections are external to the eardrum. External ear infections can occur for a variety of reasons, but frequently some moisture gets down into this ear canal. The moisture then allows bacteria or perhaps even fungus to grow. Another name for external ear infections is swimmer's ear because moisture can get in the ear and cause an infection, though certainly you don't have to be a swimmer to get this type of infection. The symptoms of an external ear infection are fairly significant pain. Often it hurts to even move that ear or to wiggle the ear at all, and particularly painful to place anything down in the ear canal. Sometimes the canal can become so swollen it's hard to hear. Also, sometimes there will be drainage of a mucus-type fluid coming out of the ear. We may think that treatment of an infection would be taking antibiotics by mouth, but that's not the case with an external ear infection. External ear infections are treated almost exclusively with eardrops. Eardrops can be used for fungal-type infections or for bacterial infections, so they can be antifungal drops or antibiotic drops. Also, it's essential to have the ear clean in order to put those drops in place. When using ear drops for an external ear infection, it's important to make sure that those drops get down deep into the ear. It's best to lay down, hold the ear, and then either yourself or have a helper drip the drops down in the ear canal. We all have a little bump right in front of our ear called the tragus. It's best to pump that several times to make sure that the drops penetrate down into the ear canal and get down to the root of the infection. In order to clean an ear that is infected, we will often use instruments like the microscope behind me and some small little suction devices. We can clean the ear and allow the antibiotic drops to get in. This will greatly speed up recovery and enhance treatment for an external ear infection. Many people will ask what they can do to prevent external ear infections, and there are several things that can be done. First, Q-tips actually make the problem worse. Avoid Q-tips. They can actually traumatize the ear canal. Also, if you have a tendency to get water that's stuck in your ear after swimming or after bathing, you can try to get the water out simply by shaking your head, or some people will use some alcohol-based drops to try to keep moisture from accumulating in the ear. Also, if you're the type of person that tends to get wax buildup in the ear canal, it is possible that that may need to be cleaned by your physician to avoid accumulation of wax, moisture, and debris within your ear canal. Though they can really cause excruciating pain, most of the time we can treat an external ear infection quite quickly and get someone back to normal in a hurry. If you're diabetic, that's a whole different situation and can even require hospitalization to treat an external ear canal infection.